Good morning po, ma'am. Ma'am, pwede po magpalista po for criminal cases kami po. Siya po. Criminal
Sir, Sir Kenneth, good morning. And thank you for your very generous introduction. Magandang umaga po sa inyo lahat. Eusebio High School, no? Na pinangungunahan ng ating butihin, no? Na si Madam Principal Annalyn Ann Miranda Makasinag. Magandang umaga po sa inyong lahat, no? Mapagpalang maulan din siguro diyan. Nandito po kami sa Batangas City. Katulad po ng ating pagkakakilala sa isa't isa, ako po ay kumakatawan sa aming Rotary Club of Pasig Sunrise. At ako naman po ay bilang Pangulo na nagsimula noong Rotary year July 1 hanggang sa June 30, 2022. Ako po ay nagpapatuloy lamang ng nasimulang programa ng Rotary Club of Pasig Sunrise na programa na may, sabi nyo nga po, ayan, partner o ang ating partnership sa iba't ibang mga proyekto na ang makikinabang po unang-una ay ang ating mga mag-aral dyan sa Eusebio High School. Kami po ang karamihan sa amin, yun nga po, yung mga pag-asikaso sa inyo ng mga proyekto, nangunguna po dyan, naalala ko ang aming siguro po mga naka-join din sila ngayon, si Past President Dan Santos, yung aming mga charter group officers. Sila yung nangungunang talagang pagkabilin-bilin, alagaan ng ang Eusebio High School, no? Katulad po nung nakaraang dumalaw ako diyan, kinagagala ko pong nakapulong ang ating butihing principal, si Ma'am Ann, kasama po ng mga ibang special na faculty members. Tungkol po dun sa gulayan, tungkol po dun sa maaring ornamentals diyan po sa hardin sa Eusebio High School. At kung ano pa po ang mga naitulong noon at patuloy po naming pagtulong, pagsuporta, tulad din po ng mga ibang non-government organizations, kami naman po ay patuloy na sumusuporta sa inyong mga programa na ang makikinabang po ay ang mga inyong mag-aral. Sama na rin po ng mga pamilya nila at ang ating po bumubuo ng Eusebio High School. Kami po ay non-profit organization. Yung Rotary Club of Pasig Sunrise po ay kabilang sa District 3800 at ng Rotary International po. Kabilang po tayo lahat dyan. Ang amin pong mga proyekto ay hindi lamang po sa Pasig. Sa iba't ibang lugar po. Karamihan po ng mga kasapi namin dito sa club na ito ay mga tubong Pasig. Ang iba naman po ay mga iba-ibang lugar. Kung kaya't kami rin po ay maraming proyekto tulad po sa Batangas, sa Bicol, sa Quezon at iba pa pong mga lugar. Salamat po sa pagbibigay ninyo, no, ng tsansa, lalo na sa pandemic na ito, upang makapagtulungan po tayo. Tulad din ng mga ibang sumusuporta sa inyo. At hayaan niyo pong ibalik ko na sa ating butihing MC, ating magaling MC si Sir Kenneth, upang ma-introduce na po niya ang ating pong Panaon Pandangal. Salamat po.
Hello, thank you very much, Kenneth. Hindi nabanggit ni Kenneth yung ibang, actually yung main job score ngayon. It's actually in the next slide, this one. I'm a fellow of the Philippine Academy of Family Physicians. I'm the president and CEO of St. Patrick's Hospital Medical Center, co-founder and member of the board of Health Hub Clinic in Makati City, program head and full professor in BS Respiratory Therapy in the University of Batangas. I'm an associate professor in the College of Law in the University of Batangas. I'm a licensed real estate broker and a licensed financial advisor. So, good morning, everyone. As you can see, I'm wearing a lot of hats. I'm into a lot of things. But like you, I am also an educator, so malapit ang mga teachers and professors sa akin because I'm also involved in the academe. So I'd like to I was invited uh, this morning actually to talk about the Delta variant of the COVID-19. I know this is a lot of concerns for everyone right now. As educators, you also worry about your students, kailan ba magkakaroon ng face-to-face na klase, ano ba mga gagawin natin, how do we take care of ourselves, how do we protect ourselves and our family. So what I'm going to discuss this morning is a little bit of the original virus, just to give a flashback on that, and then discuss some issues with the Delta variant. So I'm going to share my screen with all of you. Okay, so we're talking about the Delta variant this morning. So let's go back in the um, remind ourselves ano ba talaga yan COVID-19. So COVID-19 is a new strain of coronavirus that has not been previously identified in humans. It was first seen in Wuhan in the Hubei province of China, and since December 2019, it has been growing in globally in all of the countries. Therefore, we have identified this as a pandemic. So, tingnan natin, no, balikan natin. Look at the statistics nung August 2019, If you look at the time, during that time in August 2019, we had a total of 173,774 cases. Pinaganda lang nila, linagay nila yung 57 sa taas. These were the total active cases. So we had a total number of 173,774. Majority of the cases were mild cases at that time. And look at the changes when December came around. Okay, this is from December 17, 2020. The total number of cases grew from 173,000 plus. It became 454,447. And the percentage of positive, the positive rate that time was 6.3. No? So, kita natin yan. Look what happened. Sunod. Okay. Ito na tayo. Presently, as of yesterday, kita mo to, no? From 454, we're at more than 2 million cases. And from the percentage of our positive rates was 6.3, now it's, look at this, it's 28.1%. So you can see the big jump in our numbers. And right now, we are considering na karamihan ng makikita nating cases are from the Delta variant. Okay. So, ano ba yung usual symptoms ng coronavirus? Okay. It's usually fever, chills, cough, shortness of breath, no? Fatigue, muscle aches, headache, loss of taste or smell, sore throat, congestion, runny nose, nausea or vomiting, diarrhea, and rash. So these were the usual symptoms that we saw in the original variant. So as you can see, usually the incubation period or the symptoms would appear 2 to 14 days after you have been exposed to COVID-19. But the new incubation period is an average of 7.7 days. Actually, baka nga 6.7 to 7.7 days siya ngayon. So, what should you look at if you happen to have COVID-19 or you know somebody with COVID-19? These are emergency warning signs. Look at the problems, trouble in breathing, persistent pain or pressure in the chest, confusion, inability to wake or stay awake, and bluish lips or face or bluish fingers. No? So let's look at a certain story. How do you get COVID-19? So let's look at the different situations here. Okay. If you can see a man who's very near a COVID-19 patient. Ito siya, no? This is our patient. And as you can see, this man here, he's too close to the person. He has washed his hands, but he is not wearing his mask properly. Okay. Now let's look at the next person. She's in a wheelchair. She's also close to the COVID-19 positive patient. She's washed her hands, but wearing the mask properly. So as you can see, she is less at risk compared to the man. But look at the lady sitting on the bench. She is at a distance of 2 meters. She has washed her hands and she is wearing her mask properly. So this lady is having more protection, and the person who actually has the least protection is the man. Okay. So this shows you how COVID-19 is transmitted and what protections you actually need to do and what precautions you need to do actually. So dito tayo. Looking at the infected individual, no? COVID-19 is usually transmitted as droplets. It becomes airborne. And so as a person, you become susceptible if you do not take the precautions such as mask wearing, hand washing, because alam naman natin, pwede rin naman yung matransmit through objects or fomite transmission. Usually, the means for transmission nga is through the respiratory tract. You actually inhale it. So that's why you need to wear your mask properly. So ito nga sinasabi ko, aerosol transmission, this is a person-to-person spread. And this is usually between people who are in close contact with one another within 6 feet. So the droplets can land in the mouth or noses of people who are nearby or possibly be inhaled into the lungs. COVID-19 may be spread by people who are not showing symptoms. So, pwedeng asymptomatic ka and you may be spreading it. And since you don't know you have it, you can be spreading it from place to place or person to person, not taking much precautions. Dissemination of these droplets or aerosols may remain infectious and suspended in the air, and so you avoid aerosol generating procedures like nebulization is one, no? It's an aerosol generating procedure. Okay, so a portion of the exhaled droplets evaporate to generate aerosols. So, infectious dose of viable SARS-CoV-2 are required to cause infection. So, community spread. Now, we are hearing, oh, community spread na ang COVID-19. But what does it mean? It means that the spread is going to multiple people in the area with infected with a contagious disease and they are not sure how they became infected. Pwede naman kasi na wala kang, sa pagkakaalam mo, wala kang nakasalubong na may COVID-19 and yet, nagkaroon ka ng COVID-19. So you may have gone where? For example, the grocery store. Nag-grocery ka. Lahat naman tayo nag-grocery, no? Or pumunta ka sa palengke and you are unaware, hindi mo alam sino ba talaga ang nakasalubong ko, di ba? You don't know, and because these aerosol droplets can be suspended in the air long after the person who was infected left. Siyempre, because of that suspension and you're not wearing the mask properly, you now get infected and it can pass from person to person. So the WHO before was just saying, oh, it's aerosol. But in July, they had to admit that they cannot rule out airborne coronavirus transmission. Hindi kasi nila maisip na bakit ang bilis-bilis nito kumalat. Okay, so they finally had to consider that it could be airborne. So if it's airborne, and look at the situation indoors, especially for you, for in your household or in the workplace. Look at the situation here. In the picture above, you can see the door is closed, the window is closed, and look at the direction of the airflow. The person is speaking and there are droplets all suspended in the air. Wala siyang pupuntahan. The second photo shows you that the window is now open. Therefore, there is now a means for exchange of air. There is a direction of airflow. And if you're looking at the amount of virus in the area, there is less amount of virus in the area in the second photo compared to the first one. So this is another means of transmission of COVID, which is fomi transmission, which in there are droplets expelled by infected individuals that will contaminate the surface and objects. So this is very important. That's why we ask everybody, please wash your hands. If it's unavailable, use sanitizers or alcohol. And you have to keep cleaning your hands often because you don't know the objects that you may have been touching may have had respiratory secretions or droplets. Although in recent studies, they're saying that fomi transmission is less of a risk compared to inhaling the aerosols, still, you cannot rule out that this is also a means of transmission. Sabi daw, it's not as, hindi daw kasing taas nung isa. But still, you have to consider this. So, how long can COVID-19 stay on surfaces? Sabi natin, pwedeng ma-infect yung mga surfaces. For example, in the air, okay, sabi daw, in 3 hours. That was before. the Delta variant has changed the game plan when it comes to suspension of the coronavirus in the air. And I will tell you why later on. For copper, it takes 4 hours. For cardboard, 24 hours. Stainless steel, 2 to 3 days. And for plastic, 3 days. So, we have to clean also the surfaces in our homes. For example, you go grocery shopping. Before taking it into your home, wipe it off first with disinfecting wipes or clean it with soap and water. So again, how do you protect yourself with COVID-19? Naririnig nyo to lagi, paulit-ulit na lang. But actually, this is one of the best ways to protect yourself. Always wear a mask. Wash your hands frequently. Cough etiquette, no? Huwag kang mang-ubo ng tao. Wear a mask, takpan mo. Distance yourself. Do social distancing. Clean and disinfect the objects around you. Avoid touching your eyes, your nose, or your mouth. Okay? So, isa pa na i-add ko. Ang Pinoy ang hilig-hilig kumain ng magkakasama. You know, it's different in your household because you live together. Pero, di ba, napapansin natin, a lot of people like to go to gatherings. A lot of people want to do get-togethers. Even in the office, if you happen to be eating, they want to eat together. But the thing is, eating together, you take your mask off, and even the act of talking, or even when you're eating, you're also expelling aerosols. You're expelling respiratory droplets. So, pwede kayong magkahawaan during that time. Okay, so look at the value of wearing a mask. Look at somebody who is infected speaking towards somebody who is, these are healthy people. So they have maximum exposure, no? And look at when the lady is wearing a mask. And look at the exposure. There is minimum exposure, especially when the two individuals are both wearing masks versus one is wearing mask, the other one isn't, or both are not wearing masks. Also, disinfect your items. So you can put together a 1:100 formulation, 1/4 cup bleach to 1 gallon of water, and then you can use it for general cleaning purposes. And you can actually remember that fomite transmission is present, so you can actually use this to clean your doorknobs, tables, wag lang yung varnished ha, remote controls, your flooring, and different items. So, what is significant sa exposure to COVID? 2 days or within the 14 days from the onset of symptoms of a confirmed or probable case. And before, it used to be a face-to-face contact with a confirmed case within 1 meter for more than 15 minutes. Direct physical contact with a confirmed case. Direct care of a patient with a probable or confirmed COVID-19 disease without using proper PPE. So ito yung mga mask, face shield, gloves, gown. These are examples of PPE. But the Delta variant has become a game changer in transmission and in community transmission. We were mentioning before that the original COVID-19 virus would remain suspended in the air for around 3 hours. But this has been, with the Delta variant, this is completely changed. You know, it has really changed of how we approach COVID-19. And you know why? Because the Delta variant can remain suspended in the air for 16 hours. Ang tagal nun. Long after the person who has COVID-19 has infected the area. Nakaalis na siya, nakauwi na siya, nakatulog na siya sa bahay, and you go to that area, definitely, definitely you will be able to be, and you're exposed to that person, to the air, you will be able to get infected, and you don't know how it happened. So when do people with SARS-CoV-2 become infectious? 1 to 3 days before their symptom onset. The highest viral loads occur around the day of symptoms onset, and then they gradually decline over time. So usually, when do you do a swab? No? For usually day one, during the time you're exposed, wala ka pang makukuhang positive rates dyan, whether antigen or PCR. For day 4 of exposure, you have a 33% chance of getting a positive test. Between day 5 and day 8 is actually the best time to get a positive yield for doing antigen or a PCR test. Now, let me reiterate also that there are differences with your antigen and then your PCR. With your antigen, you have to be symptomatic already prior to using it. Whereas your PCR, you could be asymptomatic and you will get some results here. But nevertheless, the best time is day 5 to day 8 of exposure. So the duration of how long would you be RT-PCR positive? Okay. So, pag asymptomatic ka, usually 1 to 2 weeks. Mild, moderate cases will probably be positive for 3 weeks or more. And for severe cases, it may be longer up to 12 weeks. So, may mga pasyente, like we see patients, technically magaling na sila. Okay? Wala na silang symptoms, okay na sila. But still, pag nag-repeat ka ng PCR test, positive pa rin sila. Nagtataka sila. Bakit ganon? So, the virus may be dead, but the remnants of the virus may be picked up by your PCR test because the PCR test is very sensitive. And so, ang mangyayari nun, magiging positive siya. It will show up as positive. Eventually, it will decline over time. So, indiscriminate, this is important, indiscriminate PCR testing beyond the close contacts of a confirmed COVID-19 is not recommended. If you have symptoms, actually, you have been in contact with the COVID-19 patient, then by all means have a PCR done. However, because of community transmission, pag may naramdaman ka na, remember to seek medical help. And this is something that we're having a problem with patients is because takot sila magpa-doktor, takot silang pumunta sa hospital. And so sometimes they come to us, it's a bit too late already. They've been having symptoms for 1 week already. Ayaw nila magpa-doktor. Some of them don't want to, they are still in denial that they could have COVID-19. And so by the time they come to us, ang hirap-hirap ng maghabol. The rapid antibody tests should not be used as a standalone test. Actually, we do not recommend antibody testing for diagnosis of COVID-19. Rapid antigen tests that are negative does not rule out COVID-19. However, if you do have a positive antigen test, that means you do have COVID-19, I'm sure magpa-positive din ang iyong PCR test. But if you have negative rapid antigen test, it does not mean that you are completely negative. Pwede pa din mag-positive ang iyong PCR test. So what do you do if you happen to have COVID-19 and you happen to be at home? You have to do home isolation. Nangyayari yan kasi puno na rin ang mga facilities natin, hindi ba? So, first of course, stay at home, stay away from everybody, isolate yourself. Okay? Isolate yourself from the people even in your house. Kung merong kwarto doon talaga na pwede mong pagstayan, na hindi ka makikisalamuha sa kanila. Okay? Monitor your symptoms carefully. Call your doctor immediately. Tell your doctor what's going on. Monitor your temperature. And I would suggest that everybody has a pulse oximeter at home, a handy pulse oximeter at home. It's portable, it's very cheap, you can buy it online. And here you have your oxygen saturation, okay? Your oxygen saturation. This has to be above or at 95%. If this is lower than that, you have to immediately tell your doctor what's going on. And then usually this one is your pulse rate. Okay. Next, you have to rest and keep yourself hydrated. Eat very good food, nutritious food. You have to keep your doctor, your health provider, um, well, sabihin natin, i-update mo sila what your pulse oximeter says. And kasi throughout the day, magmo-monitor ka. You have to communicate with them constantly. Cover your mouth when you cough or you sneeze. Wash your hands very often. And then I mentioned earlier that you stay away from other people and avoid sharing your personal items. Even your fork, your spoon, your plates, dapat nakahiwalay yan. No? And then clean all surfaces in the area. Disinfect the surfaces in the area. Now, if you happen to be isolating already, so when do you usually discontinue the isolation? Usually, this has to be clinically assessed by a medical professional. It's your doctor that will tell you when you can discontinue your isolation. Usually, for asymptomatic people, 14 days from the original positive result is okay. For mild to moderate cases, usually 14 days again, with resolution of fever or other symptoms for at least 3 days without the use of any antipyretics or yung mga medicines na for fever, like that, for cough, dapat wala ka ng ibang symptoms ng COVID for 3 days. For severe and critical cases, it could be 21 days or more. Usually, this is judged clinically by the doctor because there has to be definite improvement. Nakikita yung clinical improvement mo dito. And the doctor would be the best person to actually tell you when to discontinue the isolation. Usually, ito namang mga moderate to severe and critical, usually naka-admit yan sa hospital. So, this is also a reminder for immunocompromised individuals. So, these are people na may mga comorbid symptoms, may comorbid illness. Ito yung may mga elderly, okay, pregnant. Yan. Ito yung mga examples ng immunocompromised individuals or people who are at risk. Immunocompromised with illnesses, elderly, and then yung may high risk kagaya ng mga pregnant. Okay. They are not included in the time-based or symptom strategy or symptom-based strategy. Yung tinatawag nating 14 days, no? All of these people have to be cleared by the doctor using clinical parameters and a test-based strategy. and isolation should not be less than 14 days. So now let's go to different variants of concern. Papunta na tayo to our discussion with the Delta variant. So before the Delta variant came, marami nang dumating na ibang variants. So in September of 2020, we had the B117, which was your alpha variant. It came from the United Kingdom. And then we had your B1351, which came from South Africa. That was the next month in October. In December of 2020, we had the P1 variant, which came from Brazil. And in October also in India, we had your B1617. So dito na yung nagsimula yung ating Delta variant. So this is the latest of variants of concern as of August 6. Okay, I mentioned some of them earlier. The Alpha variant, ito yung galing United Kingdom. The Beta variant coming from South Africa. The P1 is from Japan and Brazil. And the Delta variant from India. And of course, we also have the Lambda variant coming from Peru. And there are even new variants coming out. So it's beginning to sound like ano ba to, wala na bang katapusan to, alpha, beta, gamma. Meron ng Mu variant, no? So there's even another variant that has come out, the C12 na variant, no? So let's discuss the Delta variant more, no? The Delta variant spreads much more faster than all the other variants. When the Alpha variant came out, yung sa United Kingdom, it was 50 times more transmissible than the Wuhan variant, than the original variant coming from Wuhan. But now the Delta variant is even 50 times more transmissible than the Alpha variant. Diba? So, if you think about it, wow, talagang napaka, ang tindi ng transmission nito. So, paano kung ikaw naman ay vaccinated naman, or unvaccinated, or vaccinated, ganito, no? First, the Delta variant may cause more severe cases than the other variants. Infections can happen it happens worse, no? The symptoms are worse in people who are unvaccinated versus people who are vaccinated. Kasi we have heard also of what you term breakthrough infections, and these are infections that occur even in people who have been fully vaccinated. But let us remember that all vaccines are particularly effective against severe illness, hospitalization, and death. So they afford us this protection because no vaccine is 100% effective in preventing the disease, in preventing the infection. But they are also very good in preventing the severe illness, hospitalization, and disease and death or mortality. So, as I mentioned earlier, it's 50 times more contagious than the Alpha variant. So, there's data that the Delta variant may cause more severe illness than the previous strains. And there have been studies in Canada, Scotland, where the patients infected with the Delta variant were more likely to be hospitalized compared to the people who have been infected with the Alpha variant or the UK variant or the original virus strain. So if you're looking at this photo that I placed here, the original COVID strain, for example, would infect 2 people. But with the Delta variant, you are looking at 5 people. And each of these people would also be infecting another 5. So, napaka-exponential nitong Delta variant na to. And so, you can understand kung bakit ganyang kabilis yan kumalat. Unvaccinated people are a great concern because most hospitalized patients that we see are unvaccinated. And so I was mentioning that breakthrough infections or infections in vaccinated people do happen, but it's supposedly less in severity, and there is a documentation that there is less need for hospitalizations even. So the greatest risk of transmission is among unvaccinated people who are much more likely to contract the virus and transmit the virus. Okay. So, balikan natin, no? What are the current top symptoms of COVID-19? Now, this is based on the ZOE study, the ZOE COVID study, and June 23, 2021. So this is looking at all variants, including the dominant Delta variant. So the number one symptom is actually headache. Headache. You have sore throat, runny nose, fever, and then persistent cough. But look at this difference. There is a difference of what a person may have, the symptoms a person may have if they are vaccinated or not vaccinated. A person with 2 vaccinations, in other words, fully vaccinated, again, headache is the number one symptom, runny nose, sneezing, sore throat, loss of smell. Anong wala dito? Fever and persistent cough. Fever and persistent cough is most commonly seen in unvaccinated individuals. This is basing on the UK statistics, the ZOE COVID study. Okay, so fully vaccinated people with the Delta variant have breakthrough infections and they can spread the virus to others. Okay, although most either have no symptoms or mild symptoms, but it rarely results in hospitalization or death most of the time. No? I'm not saying it's unheard of that this would happen, hospitalizations of death, but based on statistics, it's less likely to happen. The Delta variant seems to produce a high amount of virus in both unvaccinated and fully vaccinated people. So previous variants produced less virus in the body of infected people, no? Yung mga fully vaccinated people, they produce less virus in the body compared to unvaccinated people. And vaccinated people appear to be infectious at a shorter period of time compared to unvaccinated people. So, before, when people were already receiving their full vaccinations abroad, they were saying, oh, we don't need to wear a mask anymore. But then they had to revise that recommendation when the Delta variant started becoming very dominant in the United States and the United Kingdom. So now, especially for indoors, they are recommending that you have to wear masks even if you are fully vaccinated. The Delta variant also has a high viral load. So they did the research in China and they compared it to the original virus. And they found that the Delta variant on average has 1,000 times more copies of the virus in the respiratory tracts of people infected, comparing it to the original strain. So it's 1,000 times higher ang viral load ng Delta variant. So you have to protect really yourself and wear your mask properly. The Delta infection can happen in less than 5 minutes. I was saying earlier that the Delta variant has become a game changer. Because before, direct contact would be 15 minutes. Now, it's no longer like that. Now, in 5 minutes or less, you can get infected with the Delta variant. And as I mentioned earlier, it can linger in the air for 16 hours. So you think you're alone in the room. For example, you go to a restaurant, you remove your mask. Walang katao-tao. Oh, but less than 16 hours before, somebody who was infected with the variant also ate in that same restaurant. So can you imagine that, right? So take out na lang. So let's stop the spread of the variant again with these preventive measures. Get yourself vaccinated, wash your hands frequently, keep yourself at least 2 meters distance from other people, and wear a mask. Okay, so let's look at some data on vaccination. Okay, so okay. So if you're looking at the alpha variant, this is your original alpha variant, and then your delta variant. We're going to look at, this is your Pfizer vaccine, and this is your Astra vaccine. No? If you look at the effectiveness, okay, maganda siya. No? So, kita mo naman na dito sa alpha variant, you can see that after 2 doses, you have 93.7% effectiveness after 2 doses. So, if you only have 1 dose, you only have 47.5. Okay, if you look at Astra, after 2 doses, you have 74.5% effectiveness. So, maganda siya. You really need that second dose. After the first dose, do not think you are fully protected. No, you have to get that second dose. And your antibodies will start kicking up only 2 weeks after your second dose.